wanted to tell you a story about a young man in his early 40s who works in my building. And he was diagnosed with hearing loss as a child and wore hearing aids in childhood, hated them, stopped wearing them because they were big, they were bulky. He felt like all they did was amplify the noise. And he thought that he was doing pretty well. And every day he would walk past my office and see, audiology there and, put his head down and keep going. And he really started to realize that more and more he was having a harder time with meetings at work. He was having a harder time at home. There was starting to be some friction between him and his wife because there were misunderstandings, or she felt he was ignoring her. There was a lot of frustration. By the time he got home, he was tired from listening all day. And as a business owner, he found that he was really avoiding some of the networking and meetings that he would like to go to because he knew he wouldn't be able to hear well. And then he realized that when he was driving in the car and his kids were behind him, he wasn't understanding what they were saying. So none of that convinced him to come into the office. What convinced him was he did go to a restaurant and he saw someone with hearing aids who was communicating and doing really well at an event. And so finally curiosity got the better of him and he asked this person and they said, yeah, I just got these. These are new. And yeah, I can hear what other people are saying. And he pulled out his app and they had this really great conversation. So for him, it really didn't matter as far as what audiologist said or what doctor said or what his family said at first. It was that social proof and seeing that there are people that can be successful with hearing aids. So the next day he came into my office, he actually walked in the door, no appointment, anything. He was just like, can I do this? Is this something that you work with? Got him in, did his hearing test, and I was amazed that he was walking around without any amplification because he was missing all conversational speech and just the effort that he would need to try and fill in the blanks and get involved and understand what was going on. And it was no wonder he was tired and frustrated and missing things. So the first day of the fitting, we put on the hearing aids, verified them, and his eyes got huge. He's like, I didn't realize my hearing had gotten that bad. And took them home and he wore them. And he's first day or so, he wore them maybe a couple of hours. By the time he came back a week later, he was wearing them 12 plus hours a day. He said, when I take them off, I can't hear. And I was like, well, yeah, you can't hear without them. But over the period of that first month, getting those check-ins and everything, it was really neat to watch this whole evolution in the way he thought about his hearing. Whereas before he, didn't want to talk about it, wasn't interested in hearing aids, they were horrible, to something that he started asking, well, what happens if anything happens to these? Can I buy a backup pair? Because I don't want to be without these. He was hearing his children. They're like, oh, wow, dad hears us now. He was hearing his wife. They went out to eat. He was able to understand at the table. One of the things that I thought was so interesting was he got in the car with his hearing aids on, and when the car turned on, the radio was so loud. And he said to his kids, he said, has it always been this loud? And they're like, yeah, Dad, it's always been this loud. And he said, well, oh my gosh, am I giving my kids hearing loss by turning the radio up this loud? But he's gotten to the point where he is doing amazing. And I think he's actually become an advocate for better hearing because if he sees someone now that's struggling, he's like, you got to try these. You got to try these. But yeah, less fatigue, doing better at work, doing better at home. It was absolutely life-changing and he feels younger. And I think there's something to be said for that is that when we're engaged and our brain is getting all the information that we need, it has an effect on all these different aspects of our life. So that's Dave's story.
Well, good morning. This is Don,
And this is Gina with Focused Healthy Family.
and this is podcast number 111. And today we are talking with Dr. Melissa Karp, who is a doctor of audiology. But before we get into that conversation, we want to take a break here for our sponsor.
And today we're talking about Ask the OT. This is a new program that we're starting where you're going to be able to connect via online, via phone call, Zoom, and ask questions about dealing with elderly parents or loved ones and navigating that journey and incorporating different components, dealing what if your parent has dementia and how are you supposed to get them to listen to you and follow through, and you got to get them out of their house but they're resistant and yet they can't follow what you're saying and understand. Or maybe you're wondering, does my dad have dementia? Why is he doing these funny things? What's going on? So we're building a community of support. My years of experience as an occupational therapist working primarily in adult and geriatric rehab, and my background also with my family and helping my father navigate the journey of Parkinson's disease for the past 17 years and seeing his decline and his issues with dementia and all the families I've worked with over the years in working with this population. I want to help other people with this, all this information and experience that I've accumulated. And I know how disconnecting it to be. You're juggling multiple things at once. You're going to work, you're taking your kids to high school activities, and now you're helping your parents navigate it. Maybe it's a long distance thing. So come join us in our community.
Yeah, Gina will be doing her first live kind of Q&A talk on April 2nd, 7 p.m. You can find out more about it by going to our website, focusedhealthyfamily.com. And actually, we have a little logo up there about Ask the OT, whether you can click on that and you'll find out more information about how to get involved with this community that we're building. So check us out, and we look forward to you being there asking your questions starting April 2nd. But it's good to join now and get involved with the community. There's a lot of resources up there for you to be able to pull, and we look forward to talking with you.
Yes, feel free to send us questions you have now.
And we're back. And today we're talking with Melissa Karp, who is a board certified audiologist with a special expertise in oh, this one's good. Tinnitus treatment. I should have
Tinnitus.
practiced this a little better before I did this. Audiology processing disorder evaluation, hearing aid fitting, and oral rehabilitation. She became a doctor of audiology at the University of Florida and holds her master's in science in audiology from Vanderbilt University. Since 1998, Dr. Karp has treated patients with hearing impairment and provided hearing loss prevention services. She offers comprehensive services and has superior audiology training and experience. So welcome, Dr. Karp.
Thank you so much for having me.
Uh, Really glad to have you here because, well, we just recently did a podcast with a doctor who was talking about falling and
Mhm.
hearing the balancing of the ear and all that. So it was really brought me into this whole idea about talking about, especially we're working towards the elderly population, and there's a lot of issues with hearing and balance and uh, equilibrium and all of that. So I thought it'd be
Absolutely.
really good to come in and talk about it with you.
Yes.
Um, so the first thing I'd like to do is kind of for people, audiology, most people understand it, but just to kind of explain what exactly it is, what you do.
Sure. So audiology is basically the field that works with our hearing. So it's hearing, balance, and how the brain processes sound. So audiologists are the only professionals that are able to diagnose things like auditory processing disorder. We do focus on that identification of hearing loss, but we also focus on treatment.
Oh,
So
okay.
we work all over the place. You'll see us in the schools, in the hospitals, private practice. Yeah, we're everywhere.
No, I loved your story. I think it's a neat success story to have,
Mhm.
have somebody. It almost reminds you of kind of like I've seen these things too with people, well, little kids with when they put glasses on and they can see their parent and it brightens them up. Well, it's same kind of thing. They're now hearing things that they hadn't heard before or haven't heard, their kids' voices in clarity and all that. But it has to be so rewarding. The question I kind of coming off of that is, you talked about him having a hearing aid. Now, are there situations with this? Oh, I didn't turn my phone off properly. I apologize for that. Um, is there situations where you can also actually correct the hearing versus having to put a hearing aid in?
Absolutely. There are different types of hearing loss. So there are hearing loss types called conductive hearing losses, and it's kind of just what it sounds like. If there's, a mechanical issue. So those are often correctable by medication or surgical treatment. So if you think about a child with an ear infection, that's fluid in the middle ear space and it creates that conductive component. So sound isn't able to travel as well to the brain. Earwax impaction, that's considered conductive hearing loss. But there can also be other issues in the middle ear that are very fixable. And that's what an audiological evaluation does, is we can actually test and see what type of hearing loss a person has, whether it's conductive, that we need to refer to an ear, nose, and throat specialist, or whether it's sensory neural, which involves the hearing nerve and can be corrected with amplification.
And you also mentioned in that the conversational speech, what are the different types of things that how we hear? The conversational, I'd like to kind of get what does that mean, and what other types are there that we hear?
Yeah, so I mean, we hear all sorts of things, but I find it's easy to explain when I talk about types of hearing loss. So for someone that has a mild hearing loss, they're going to be missing out on some of the softer aspects of speech and the rustly noises and whispers, things like that. When we start getting to mild to moderate hearing loss, that's when you're going to start missing bits and pieces of softer speech, maybe further away. You might be missing more of the high frequencies of speech. So you might be able to hear someone talking, but have a harder time understanding. And then, that moderate to moderately severe hearing loss, where other people would hear conversational speech, you would barely hear it at a whisper level.
Hmm.
So when you start thinking about how does this impact someone day to day, we know that even a mild hearing loss can be impactful depending on what someone's listening situations are. So
Sure.
it's kind of hard. We say it's mild, but it may not have a mild impact on someone's quality of life.
And they might be blasting that radio a bit loud, too loud.
Yeah, ask my children about that. Both as an OT working in adult and geriatric rehab, I see hearing loss as a big issue. But I know I definitely have mild hearing loss and at some point need to have that further investigated. Because for me, being like in a restaurant with background noise and being able to hear the conversation of
Yeah.
people right there in front of me is so challenging. And if someone has a soft or low voice, it's frustrating to,
Well, sure. And you probably find that you're leaning in and you're
oh yeah.
watching their mouths more and you're trying to fill in those blanks. And sometimes you're going to be successful and other times you're not.
Yeah.
Mhm,
So then
mhm.
you might find yourself agreeing to things that maybe you shouldn't have agreed to. So, but it's
Yeah.
also fatiguing. So by the time
Mhm,
you've gone to a restaurant and you've had this, what should have been this lovely occasion out, you're tired at the end of it.
mm,
And what we find, more in some of our elderly patients is that they've gotten to the point where they stop going out because they're not going to be able to hear anyway. And
mhm,
they don't want to be missing out on the joke or missing out on the interaction. So they stay home. And then you get that social isolation. And that
mm,
is one of the factors combined with hearing loss that lead to increased dementia risk.
mm. That makes a lot of sense.
Well, and white noise tends to cause problems for me, like being in a room and you kind of get all that buzzing kind of white noise kind of thing going on in a
Mhm.
room, and it makes it harder then to, I know for myself to hear. I don't know if that's fairly normal or if that meaning I'm having some hearing problems.
Yeah, well, you know what? I think it would be great to get you to come in and go
Yeah,
through
we
a
do.
hearing test and see what it's like.
Yeah.
Yeah.
Yeah. Well, and I have been in your office, and you got some neat stuff going on there, and all. But I know you're excited about this new study that you brought up when I saw you a couple weeks ago, and so
Right.
I'd kind of like to delve into that. First, tell us about what this uh, is. It called Enhance? I noticed was that what the study was called, Enhance?
Yep. So
That's what.
there's actually a couple of studies that have come out, and Enhance study is really the most recent. So if we kind of go back a little,
Hmm?
probably one of the first studies that I find like super intriguing was Franklin from Johns Hopkins in 2011 showed that the risk of dementia for people with hearing loss compared to those with normal hearing was estimated to be double with mild hearing loss, almost triple for
Wow.
those with moderate loss, and almost 5 times greater for those with severe hearing loss. And that's what really led to these studies like Enhance and Achieve that answered the questions, can this dementia risk be prevented or reversed by treating the hearing loss?
Mm.
So the Achieve study, that also came out through Hopkins, and that was in 2023. And Achieve is aging and cognitive health evaluation in elders. And they followed 977 adults in that 70 to 84-year age range for 3 years. There were 4 sites across the country, and patients were either assigned to get properly fit hearing aids with an audiologist or general health education sessions every 6 months. And they found that the hearing intervention group, the hearing aid group, reduced cognitive changes by 48%
Wow.
over 3 years. The new study, the enhanced study, pretty much confirmed those findings. This was actually done in Australia, and enhance is evaluation of hearing aids and cognitive effects. And they followed, it was 262 patients, and they were ages 67 to 87. They were either fit with hearing aids or they were unaided, and they showed that the hearing aid users were significantly better at the cognitive performance 3 years post fitting. And that really goes along with that idea that hearing intervention can actually delay cognitive decline or dementia onset in our older adults. So it's super exciting.
Yeah, that is. I know working in adult and geriatric rehab, I encounter a lot of people, and we have to distinguish, is there hearing the issue here? Or are they not understanding and processing the information? So kind of that overlap of dementia and hearing loss, which it makes sense that if you're not hearing as well, you're going to engage less and probably participate in less activities. And I can see that connection, and from many aspects.
Yeah, and we've known for quite a while now, but there was also a great study done at a University of Colorado by Anu Sharma and forget the name of the other researcher. Her last name is Glick, but they looked at people who had hearing loss, and this is mild hearing loss, but they showed that even those who had a mild hearing loss, that the brain actually starts to reorganize and use the hearing portion of our brain for other purposes like vision. So it actually reorganizes. It's called cross-modal reorganization. And for even those with mild hearing loss, it's associated with poor cognitive function, poor executive function, lower processing speed, and working memory deficits. But we can actually change that through properly fit hearing aids.
So what I was wondering, so there's some physical things, are some things literally going on in the brain
Yeah.
It's trying to adjust and adapt, really, is what that sounds like.
Well, sure. I mean, we probably all heard about people that say, oh, once I, lost my sense of hearing, I can see better. Like one sense kind of takes over for the other. So it's not an old wives' tale. There actually is some of that cross training and cross modality reorganization. But the cool thing is that if we can give back that sense, if we can get that hearing back to the brain, then the brain will actually reorganize back, and
Mm.
the auditory system will reclaim those areas again.
I had a thought and it just went right out as
Probably need to get you fit with hearing aids.
Happens to me all the time.
um so is there I know what I was gonna say. Is it a certain point where you can't where it's too late to do that, or can anybody kind of get it back?
You know what? I don't know that there's been an age limit defined. We always advocate for early intervention
Hmm.
because the earlier you can intervene, the more plasticity the brain has. We used to think that there was just this window of plasticity, but what we've found, is that even older adults and our elderly adults, do have plasticity and can learn, and there can be rehabilitation.
Mhm.
So while we do stress early intervention, I've seen people get their first sets of hearing aids in their 80s or 90s. I've seen cochlear implant patients in their 80s, and they get benefit.
Mhm.
So, it's just a matter of making sure they're fit properly and making sure that they have access to the rehabilitation.
Well, I'm sure there's probably still a lot of misunderstanding about because I still get people that say, "Oh, this darn thing doesn't work," and it so they probably haven't got it adjusted properly or put in or implant not implanted, but
Fit properly.
set up correctly.
Yeah, and I think that is a big problem in our industry. So even our national organizations have come out with data that says that only about 30% of audiologists and hearing aid fitters actually do real ear verification. And that is so, so important to making sure that people have success with their hearing aids, because ears are different. And it's psychoacoustics. I can, you know, sit in a small room and yell, and it's going to be much louder. But if I yell in a baseball field, you're not going to hear it as well. Sound actually has to be measured and verified, because otherwise we don't know what is happening in the ear. So the way we verify hearing aids is we actually put a tiny microphone down in the patient's ear. And when we set hearing aids, it's a prescription, and it's based on their hearing loss. So we know, based on that hearing test in the booth, how much gain or volume someone needs to hear all of the different speech frequencies. So by putting this little microphone in the ear and running these tests, we get an objective picture of how much gain should be at each frequency to meet those prescription targets. And so if you've gotten hearing aids and you've never had someone put a little microphone down in your ear and play different speech sounds and adjust and check, then your hearing aids have not been verified properly. And that could be a big reason why you may not be doing well with them.
Interesting. I have a conversation with my mom because she got hearing aids and she says they don't do anything for her.
And they
So,
may not. That's the hard part. You don't know.
mhm, mhm.
Well, I like the fact that they now connect with Bluetooth because my brother has hearing aids and he answers the phone by tapping on his hearing aid.
Yeah.
And he adjusted. We were talking about it, and he said, "Oh, wait a minute, let me get it on. I didn't tap my hearing aid. Let me get it on there so I can hear it better and talk to you better." Uh,
Yeah.
so, so we can do all of that factor. I take it, it can be a microphone too, as far as
Mhm.
it'll.
Yep, there's different hearing aids do different things. There are some that work with Bluetooth Classic that you can, tap, and your hearing aids are wireless completely, and you've got your microphone and your your receiver and you can just walk around the house chatting on the phone or streaming your podcasts.
Mhm.
You've got other hearing aids that are more made for iPhone that may need an accessory. But yeah, there's a lot of different options out there. We can connect directly to computers and televisions, and
Wow.
now Auracast is going to be coming out, and that will be great for different venues like concerts or places of worship where there's a speaker that can then go to any Bluetooth device. And so we've actually have hearing aids that are prepared for that already, being Auracast ready.
Yeah, well, I was curious, what does that mean? Or because I might have pronounced it wrong as I said it, because I think I said it more as oral, but it's oral.
Oh,
What?
so Auracast is actually more of a Bluetooth technology
Oh, okay.
that will be used like in theaters and places of worship and any time you have like a microphone you want to um, like in a theater, you want people to be able to tune in with their devices.
Oh, okay. Okay.
Oral rehabilitation is actually working with patients to help them learn how to hear again. So sometimes it's not enough just to put a device on. Sometimes we really need to sit down and practice, almost like speech therapy in a
Mhm.
way, is that we're doing auditory training and giving the brain lots of opportunities to hear these sounds again, especially if you haven't heard them in years or you've heard them distorted. But with proper amplification, going through and making sure that you can tell the difference between an and an n with just your auditory system. And we also train hearing and noise and rapid speech. And then there's also something as part of oral rehabilitation where we talk about what are good listening strategies and for the speaker and the listener. So not talking in the other room and making sure you're facing someone, those good communication strategies.
Sure. Yeah, there's so much to it. And being an occupational therapist for 30 years now, I've just seen the technology. I don't know a lot about it, but just know it's improved greatly what, is out there and as far as like hearing aids and those things. Um, and it's exciting because for a long time I heard people just complain that it just increased the background noise and all the
Yeah.
other issues that were a big part of the older devices that were out there. So it's fascinating to me, and it's wonderful to learn this because we do put a lot of emphasis on speech, like working in rehab. There's a speech therapist, a physical
Mhm.
therapist, occupational therapist, but yeah, the hearing aspect is, and it's so important. They have to be able to hear us for us to communicate with them, for it to follow our directions, and when they can't, it really interferes with that.
Well,
Yeah,
especially when you have a
absolutely.
mask on and all the gear that you sometimes have to wear, especially nowadays,
Mhm.
it makes it even harder to hear, and you can't read lips and all that.
Yeah, that's definitely COVID made some huge changes, as far as the hearing world, because people realized how much they were lip reading.
Hmm.
They were home more, and they realized that, wow, I'm really missing a lot of information. They were on Zoom a lot and got a lot of that auditory fatigue. So, I think some of the positives that came from that were people did realize that they had hearing loss
Hmm.
and were more likely to go and get their hearing checked. There's been a big jump in captioning technology.
Hmm.
So we've got things that patients can caption on an iPad while they're streaming or Zoom, Microsoft Teams. A lot of the platforms now have closed captioning enabled. Um, what are some other things that came from that? Oh, being able to do some remote hearing aid adjustments.
Oh,
So the technology is actually to the point where after we fit and verified a patient's hearing aids, they can be at home and say, oh, can we get this tweaked? And we can have a session through the computer. I can send changes to the patient's smartphone, and the
Wow.
smartphone can change the hearing aids
Wow.
without them ever having to come into the office. So
That's
it's
amazing.
really, it's gotten very cool.
yeah, yeah, it
It's
sounds like it. So maybe moving into the senior population and talking about the relationship between falls and hearing and what the different aspects of that are.
Mhm.
So I like to think about this as have you ever been driving and you're not exactly sure where you're going? So when you get close to where you're supposed to be finding the address or the turn, you like turn down your radio.
Mm-hmm.
So that is cognitive load. So if you're using more of your brain power to focus on listening because your hearing isn't good, that takes up resources that you would use to monitor the environment for fall hazards, and paying attention to your foot placement and your gait. So there's only so many resources we can make sense of at one time. And what they found was that people with untreated hearing loss are more likely to experience and report falls. For every 10 decibels of hearing loss, which is not a lot of hearing loss, the odds of reporting a fall increase by a factor of 1.4. So they've also shown that using hearing aids for at least 30 days can actually reduce the risk of falls. So those who wear properly fit hearing aids have greater stability. They can remain stable for longer periods of time. And that's when we compare them to people who don't wear hearing aids and have hearing loss.
That's yeah, that's very
It's a
impactful.
lot. It's a
Yeah.
lot of fall risk. So,
Mm-hmm.
Well, yeah, and then the fall risk then can turn into quick decline. Um,
oh, absolutely. And I'm sure, Gina sees that all the time.
Mm-hmm. Yeah. Um,
got me all choked up here.
yeah, just the part it has on dementia, and just, I never thought about that aspect of the brain, that the cognitive overload, and that if you're having to really focus and tune in to hearing, it's affecting your ability to process other information. And yeah, it's kind of a new conversation I can have with clients and their family members that I work with, and how important it is that, the hearing aids are working properly for them, because yeah, falls are a huge buzzword in my world. And
Oh, sure.
Speech is a bit of a problem for me right now.
You okay?
Yeah, I don't know if I'm probably talking too much. With this, we had another interview this morning, so this is number two, and I've probably been using up my vocal abilities here. Um, so um, I guess if you got somebody that's sensing that their loss of hearing, I guess what would your advice or recommendations be for them to
as far as
do?
like the first step. And
Yeah, first step, I would say, see an audiologist. So get a medical evaluation of your hearing. And really, we recommend that if you haven't had a baseline hearing test by the age of 50, that you go ahead and get that scheduled.
Mm.
And, that's a really good way just to get, like I said, a baseline and see what are you hearing, what are you understanding, and going from there. When you go for that evaluation, we always talk about other health issues that can contribute to hearing loss or increase your risk of hearing loss. So things like diabetes, heart disease, family history of hearing loss, history of noise exposure, certain medications, all of those things that might be contributing to increasing your risk for hearing loss. We can talk about that and say, okay, well, you know what? You really don't have any risk factors. We'll see you in 5 years. Or we might say, wow, we've noticed a little bit of hearing loss. Let's monitor that. We might want to see you in a year. Or if anything changes, let us know and we'll follow up. But it's good to have that baseline. If you're noticing difficulty hearing, we'll go over those results, because there are different types of hearing loss. We talked about conductive and sensory neural. There's also what we call auditory processing difficulties. Sometimes that's called hidden hearing loss in some populations. So this is for people who have gone to the doctor and had their hearing tested, and they say, gosh, I just can't hear a noise. I really feel like I have a hearing loss. But then that hearing test where they just do the beeps, they're like, oh, no, you hear great. It's all in your head. Well, yeah, your brain's in your head. So it is in your head, but not that way. But, a really good hearing test looks at your ability to hear and understand the background noise as well. And we can start looking at some of those processing issues. So there's treatment for that too.
Mhm.
I was kind of curious that you brought up like I deal with heart issues myself.
Mhm.
How is it that affects the hearing? like say for instance, I've had a heart attack. I've had open heart surgery, so I have how do they classify my?
Cardiovascular disease.
There you
Yeah.
go. How does that affect hearing or autism or any of the different things you mentioned?
So cardiovascular disease, anything that affects your vascular system, the ear is very oxygen dependent. The
Oh,
hearing mechanism is very oxygen dependent. So anything that can affect that oxygen supply to the ear can actually cause cell death in the inner ear. So what we're looking at is making sure that, if you've had a heart attack, if you've had open heart surgery, if you've had these periods potentially of anoxia or oxygen deprivation, that might contribute to difficulty hearing.
okay. So
Yeah.
it's the oxygen coming through the blood versus
Hmm.
it isn't so much coming in air coming in through the ear necessarily.
Right, right,
Okay.
exactly. It's the blood supply.
Okay. Well, that explains it then. Uh, Gina always says I had a little bit of a cognitive loss, and I think it did when it came to when I had the heart attack.
Sure. I
So
mean, and whenever you're without oxygen, it deprives that brain and it can affect different things. So,
Yeah, absolutely. But you're
well,
doing well now.
yeah. I mean, my hearing's not that. At least I don't think it's bad. I mean, the white noise thing is a little bit of a problem, but
Mhm.
I think I'm doing yeah pretty good for what I've been through with all this stuff. Um, so any last thoughts that you'd like to let our audience know about as far as your audiology world?
Yeah, I mean, I would really say that going to the audiologist is not a scary thing. We are there to help and make life easier, and getting the information is really the first step. So making an appointment to see an audiologist, getting a baseline, and really being upfront about what are your goals and what are your concerns, because there are a lot of tools at our disposal that may not be hearing aids. They may be other assisted listening devices and options that can make communication easier. So that's really the goal. And the point is, I like to say that when one person has a hearing loss, everybody around them has a hearing problem. So even if you're not doing it for yourself, think about the impact that it may be having on your friends and your family and your colleagues. And it really is important to be able to hear well, protect that brain function, and be able to be a big participant and enjoy your life.
Yeah. Yeah. But when you told the story about the kids, in the car saying, yeah, the music's always been that loud, I
Yeah.
think about that myself because I blame it on concerts and loud music when I was younger, affecting my hearing today. And yeah,
Yeah, I
I,
noticed it this morning. I had to go somewhere. I got in the car you usually drive, and it's like, whoa, what? Okay, let me turn that down a little bit. So we might need to get you in to see Melissa
no,
here,
well, it's like we don't think twice about going to the eye doctor and, corrective lenses are such a part of the everyday world, and yet we kind of put hearing on the back burner and just
So,
accept.
think about it like when you turn 50, you're supposed to get a colonoscopy. So my
Hmm.
testing is much easier. So think about your ears and your rears and get both done at the same time. Well, maybe not at the same time, but schedule them. And trust me, it will be much nicer at my office. So
Yeah.
But now, do you put us to sleep like they do with it now? Now,
no, no,
they've
you
changed
don't
it.
get the propofol nap. But we do have good chocolate and coffee, and
Okay, well
we try to make
that's
it a
good.
nice experience.
Well, Melissa, this has been really fun to talk with you as always, and the information is wonderful because I think this, especially now, like I say, with our audience being this more the senior population, this is a big issue for them in a lot of ways.
Well,
So,
and not even just the senior population, but as myself,
well, yeah,
I've got to be able to communicate. And my dad, he's got Parkinson's and he talks really soft and really low. And I have to really lean in to hear him. He was in the hospital several months back with COVID and had this loud filter in
Wow.
his room, and it was so hard to hear things that he was saying. And so, yeah, it's affecting me and my ability to care for him and my children, not wanting to contribute to hearing loss in them. So I've learned a lot personally and professionally talking with you. And
Oh, thank you. And, I love being able to collaborate with occupational therapists, especially, with our patients who have hearing loss first so that they can hear you, but also, sometimes there's dexterity issues and being able to work with occupational therapy to make sure that patients can be independent and put in their hearing aids and put them in
yes,
properly. There's
yes,
a lot of really
sure.
good collaboration. So totally appreciate the occupational therapy contribution. So
Yeah, I've helped many a person put their hearing aids in, and I don't always, they have to often instruct me on how to do it. I haven't had a lot of, experience in the proper way to do that, but I've seen the difference of hearing aids. So yeah, that there's that aspect. If they can't put the hearing aid in, then it's not going to be effective for them.
Well,
exactly.
and like you said, being able to get them back into the activities of life that they probably have stopped doing, that's what occupational therapists are about, is getting back into the ACL, what is it, what ACLs, activities of, what is it?
Well, activities of daily living are your daily things that you do, but
ADL.
participating in social activities is
Yeah.
such a part of keeping your brain active. And yeah, so
So, well, Melissa, again,
Thank
it's
you so
been
much.
wonderful to talk with you, and we really appreciate you being on here, and probably have to get in to see you pretty soon here,
yes.
I think. I don't have to blast the radio. Um, anyway, that's our show for our podcast. You do it.
That's our podcast for today. We really thank you for being here, Melissa, and we hope to talk to you more in the future. And for all of those listening, you can learn more about Melissa. We'll share it, information in the notes, and check out our other podcasts. Join us at focusedhealthyfamily.com to learn more about other programs that we're offering, like the parent coaching that we do, as well as working with people like myself with the sandwich generation of caring for aging loved ones, as well as raising their children and dealing with their own issues, right? And taking care of yourself. We do a lot of talk about self-care. And so I'm hearing this message loud and clear that I need to have my hearing taken care of and so that I can best affect other people. So
And also look for our newest adventure is Ask the OT. And it is for our senior population and the caregivers to be able to get online with us, join our community where you can find out and ask the questions that you need for what's going on with your aging loved one. So, uh, and remember, how you speak to your kids today shapes their future and yours.